Good morning, everyone. Welcome to Center of Balance Live. My name is Kenny, the acupuncturist and Chinese medicine practitioners from Center of Balance. Today, I'm going to talk about how to use acupressure points to help nosebleed. If you are watching these, please give me a thumbs up, like and share this video for those who might benefit from this video. Do you or do you know anyone who suffers from nosebleed? If you do, please type 1. As usual, let's get one of the three tools ready. So one can be your finger, your thumb, or your middle finger. Number 2 is your knuckle, where you bend your index finger and then make sure your thumb is underneath to support it. Number 3 is a massage device or some small rounded tool. So any of these 3 tools can be used to locate sensitive points and apply pressure for 30 to 60 seconds, and then you move on to the next sensitive points. Okay, and you can repeat that 3 times. You can do it up to 5 times throughout the day. But almost everyone has experienced a spontaneous nosebleed. Occasional nosebleed are very common because our nose contains very many tiny blood vessels which are located close to the surface in the front and back of the nose. And the nasal lining is very fragile and sensitive. Nosebleed are a nuisance, and if nosebleeds are regular, frequent, or very heavy and hard to stop, you should pay a visit to a doctor and consult about the underlying causes. There are 2 kinds of nosebleed. An anterior nosebleed occurs when the blood vessel in the front of the nose break and cause bleeding. The second type, and can be the dangerous one, is the posterior nosebleed, occurs in the back or the deepest part of the nose. That's what is dangerous because the blood can flow down the back of the throat and can cause choking. There are many causes of nosebleed, such as environment. The exterior condition, such as dry air, is the most common cause of nosebleed. Too much heat, living in a dry climate, dry environment, and using a central heating system heater can dry out the nasal membrane, which are the tissues inside the nose. The dryness can cause the crusting inside the nose. The crusting may itch and become irritated, and then if your nose is scratched or picked, it can bleed. Number 2 can be allergies, cold, sinus problem that can dry out the nasal membrane. If you take antihistamine or decongestants, can dry out the nasal membrane and cause nosebleed. Number 3, you can blow your nose quite frequent, which can cause another nosebleed. Other common causes of nosebleed include getting struck or foreign object stuck in the nose, chemical irritant, allergic reaction, injury to the nose, picking the nose, as you mentioned earlier, the upper respiratory infection, and other medical conditions can also cause nosebleeds, such as hypertension or high blood pressure, bleeding disorder, blood clotting disorder, or cancer. Acute nosebleed that can be handled at home with following steps. Proper posture to stop bleeding. In other words, you sit upright, you lean forward and breathe through your mouth. This is very common and very tempting to lean back when you have a nosebleed to prevent blood from dripping down your face. However, leaning slightly forward is the best options, because this can prevent the blood from going down your throat, which could lead to choking or vomiting. And also make sure you focus on your breathing through your mouth instead of your nose. Okay, and try to remain calm. Number 2, you resist the urge to use cotton bud or tissue stuck up the nose too often. Okay, to even try to stop bleeding, because this can be worse, as it can irritate the blood vessel and more, not enough pressure to stop the bleeding. Okay. Step 3, you use the tissue or damp cloth to catch the blood as it comes out of the nose. Then you can pinch and squeeze the soft part of the nose below the nasal bone for 10 minutes to compress the vessels and stop bleeding. Do not let go of the pressure for those 10 minutes, or else you have to start over again after bleeding and restart. Final step, if the bleeding does not stop, apply fresh packing and pressure for another 10 minutes. If cannot stop for 30 minutes and bleeding quite significant, make sure you seek the medical attention immediately. So what to do after a nosebleed? Do not pick your nose, okay? You don't want to irritate the nasal membrane more. Do not blow your nose. Resist the urge to blow out the dry leftover for at least 24 hours. Do not bend down, lifting heavy object or too much physical activities. This will prevent straining. Keep it light. According to several resources, ruptured blood vessel needs 7 to 10 days to heal completely. Do not pick your nose, as we mentioned, or try to blow off the dry scabs during this period too. What can we do to prevent future bleeding from the nose? So, exterior ear dryness, obviously, which cause all that dryness inside the membrane. So you want to use a proper nasal gel or appropriate lubricating ointment, or just keeping that lining of the nose moisture will be good. Use of humidifier to add moisture to the ear to keep the mucous membrane from drying out. You can use that around the house, around the room. Again, avoid lifting or straining. Elevate the head on 1 or 2 pillows while sleeping. Try not to take or do not take cold or allergic medication and drugs that thin the blood. Quit smoking and alcohol, or even just moderate slowly. Okay. How do we diagnose nosebleed in traditional Chinese medicine? In traditional Chinese medicine, the nosebleed are often result from excessive heat in the body, and somehow nosebleed is regarded as a way of draining away the heat by the body, and also a few organ dysfunctions such as the deficiency in the function of lung, spleen and stomach, kidney or liver organ can weaken the blood vessel and give rise to nosebleed. Of course, because all these deficiency over time, it can generate heat inside our body, and then the heat tends to rise up to our nose and causing to bleed out. I'll share one of my case with you. As one of my close family members who had nosebleed every second day for a few months, and that was before. Also, I think it was just this year. I went back to Crawshaw to visit them, and it was quite bad too, with bright red blood gashing out, and took at least 20 minutes to stop the bleeding. Or even worse, he could wake up with blood on his pillow. After I spoke to him, I found out he has been too busy with work, months, and I'm talking about months of late night sleep, or just sleep after 2 or 3, just few hours of sleep only, waking up super early, irregular diet, and been drinking lots of alcohol. Straight away, I took his pulse and I needled 6 points while he's lying down. And just as he was lying in bed, within the 10 minutes, he said to me, "I can feel the heat coming out from my nose." I was quite surprised and happy at the same time, because knowing that going with the pulse and asking all the questions fit the pictures, and just from him telling me all the stories as well, it just fit the pictures. And so that's why I chose those 6 points. Just the first 6 points according to the pulse. Straight away, or within the 10 minutes, it released the heat out from his nose. And I leave the needle in there for about half an hour. Afterward, I advise him to cut out his alcohol, instead drink lots of warm water, and sleep early, please. And just make sure you have good quality of sleep and well-balanced diet. So what can we do to help ourselves, especially with self-massage of acupressure points? Don't forget to like and share, and most importantly, show us some love by giving us a thumbs up. Right, go on the thumb side, on the wrist. You can use your finger on the wrist here. Use your finger, you press and massage the spot for 60 seconds. And on the palm, and the depression behind the bone, and on the thumb muscle, about midpoint is at the junction of the red and white skin. And so you use the finger to press and massage the spot for 60 seconds. And then you move up and massage all 360s of your thumb. Then you go down your index finger. It's on the dorsal aspect of the hand, at the junction between the first and second metacarpal bone. And you move distally, about the junction here. You massage for about 60 seconds. Okay, and then you keep moving up along the thumb, along the index bone, and then after that you can massage all 360 of your index finger. Sorry, just a bit of a noise there. And then the last one, you flex your elbow, and you can see the point is at the lateral end of the transverse cubital crease. So basically, you flex your elbow, you can see a line there at the end of the line, or within the area. Palpate for the most sensitive points, and then give the area a massage up to 60 seconds. Okay, just massage for about 60 seconds. Of course, some of these points may not work for you. We, the traditional Chinese medicine practitioners and acupuncturists, has a lot to consider, such as the characteristic of the bleeding, including the duration, interval, amount of bleeding, color, and even the textures of the blood, the overall condition of individual body. That's why we ask series of questions. Also with checking your tongue and pulse to identify a disharmony pattern. So it's important for us to do an initial examination to come up with the best possible care plan specifically for you. So please call us or email us info@balancetcm.co.nz to book an appointment. We have 3 clinics in 3 different places: Hamilton, Raglan and Auckland. My name is Kenny. That's all from me today. Sorry about the interruption before. And thank you for joining us. I look forward to seeing you guys again. Stay awesome